Okay, so this is an 84-year-old who had severe MR from P2 prolapse, CKD3, had a GI bleed, hypertension, AFib with RVR, diastolic heart failure. And she had severe scoliosis, which left her pretty frail, so she didn't move around a lot. Pretty spunky, though, and she was deemed high risk for surgical mitral valve repair by us, and so we consented her for Class 2D. So when we got in there, we didn't really appreciate how bad her scoliosis was. So as you can imagine, she was extremely, she had a really bad spine curvature. And if you can see my catheter, that's where it's supposed to be. That's where the septum's supposed to be. But if you look at the echo image, you can't see my catheter anywhere. And so that's when we realized, how bad her anatomy was and that her septum was not in the typical place. So I tried many different catheters to try to get to the septum. We tried an SL1. I knew that the catheter wasn't reaching. And so after a couple of different transeptal sheaths, I switched to the Agilis catheter so I can just sort of bend around and look for it, which was the right thing. But the dilator of the catheter kept pushing me off the septum. So I pulled back the dilator just for a second, and the Agilis sheath went right to the septum, so you can see it. And so now I was like, all right, I'm here at the septum, we can proceed with the case. And then I call for the needle and then realize that my needle is too short for the Agilis catheter. And this happens a lot of times when you're in the middle of a case. You realize that you don't have the right equipment and your hospital doesn't stock the right equipment, but you didn't think about it beforehand. So I was trying I was like, okay, well, maybe we can put a guide in or a diagnostic catheter, but again, still we had the problem with the catheter, with the needle size. So I knew I was at the right height, and I didn't want to move and didn't want to change anything. So I decided to take the back end of the Agilis wire, and remember it's an 025 wire, so it's not an 035, so it has a hard time, with I didn't want to put a balloon over it or anything like that. So I took the back end of the wire, stuck it through the dilator, and used the dilator more as just kind of a pushing force, and then bovied it to get used it basically as a spear to get the wire across, put the catheter back in, and then finally got the sheath across. And then had a nice result with our Pascal. So this was just one of those things that when you realize that you don't have the right equipment, that you can figure out ways to get across in almost anything. So that's it.